So we're just going to go ahead and recap some of the key points of the things that we demonstrated and mentioned throughout the sessions, talking about rolling, going from supine to sit, going from sit to the chair, with whether it was with one person or two-person assist. Anytime we're managing the patient in the bed, whether it's for hygiene, linen changes, etc., make sure the bed is at your waist level. You want to avoid having to reach down and over onto the patient. Waist level, so it's more ergonomically correct for you.
Also, dropping the rails could help you to become closer to the patient.
Of course. In addition to that, other things to keep in mind is when you're in doubt, err on the safe side and ask for a second person assist. Even when you're just trying to boost a patient up in bed, if you're getting the patient up for the first time, take that second set of hands until you're comfortable with the patient. The last thing you want to do is jeopardize your health and potentially your lifelong career, essentially, as a clinician in the healthcare setting. Other things we want to do is when we're planning to get a patient out of bed, plan your route first. Don't just go in, okay, let's get up, and then you're in the middle of the session and you're thinking, oh my goodness, where's the chair? The lines are tangled. Make sure the lines are in place and organized before you get the patient to the chair. Have the chair positioned at least a 90-degree angle or a little bit less and close to the bed. A lot of times you'll find that we will drop the rails on the entire side of the bed just to help bring the chair as close to the bed as possible. Make sure the patient has on the proper footwear, so the yellow socks as applicable. Use a gait belt around their waist so it gives you something to hold on to, and for many of our patients it gives them a sense of security and confidence with your ability to transfer them. Other things that you want to look at when you're doing any activity with the patient is your stance and your posturing. You want to use good body mechanics. So when you're standing at the side of the bed to work with a patient, keep your feet shoulder width apart. When you're having to do any excessive lift or boosting in bed, use your body to shift your body weight, whether your feet are parallel to each other or staggered, knees are bent. You can go forward and back with the stagger. From side to side, you can go up and down for the upward scoot in the bed. When you're transferring the patient, think about your feet. When you start, your feet are facing the patient. When you finish, patient's going to the chair, your feet are facing the patient. If we don't pivot on our feet, what ends up happening is your body's twisted, causing that spinal rotation that we're trying to avoid.
Whenever you go to position the patient to get ready for a transfer, you always want them scooted close to the edge of the bed. If they're able to, place their hands on the side of themselves so they can help boost. And if they are slightly taller, you can raise the bed up higher as long as their feet are still on the ground, just to give yourself some extra leverage to get the patient up.
I think one other key thing is we sometimes are very quick to get the patients up and we just assume they know what we're going to do. Make sure you explain to the patient what the process is and what the plan or the course of action is going to be in advance, so that the patient is not in standing and now they're at a loss of what's next or what is the nurse or the therapist expecting from us.
They don't become anxious.
Exactly. And again, just when in doubt, always ask for that second person of assist. When you have that second person, if you're the one asking for that, be sure that you're then going to guide the activity, because one person needs to take ownership or charge of the event to help keep everybody in line step by step of what's expected. That's it.
Thank you.